Okay, this video is, what is cancer, part 6. It's sort of like chapter 35 in the book. It's from actually page 505 in this book here called The Medical Reformation and Vegan Renaissance by me, Pete Rogers. And we're just continuing to talk about cancer. We're going to talk a little bit about epidemiology. This right here is northern Mexico, in the area called Sierra Madre Mountains. Sierra means like a saw, so the edges of the saw are multiple mountains next to each other. Sierra Madre Mountains, Copper Canyon, that's where the Tarahumara live. And their name sort of means like fleet runner. They're world famous ultramarathoners. They eat an old-fashioned indigenous Mexican diet, lots of corn, local greens, beans. They're famous for running about 100 miles in 2 days. And every guy in town can do it. It's not like just a fast guy. They used to be combined with the Pima population in northern Mexico before the Mexican-American War in 1848. Then the Pima were absorbed into Arizona, and they eat the SAD diet, and they're all fat and sick. So it's kind of just it's a great epidemiology comparison. Because one of the things you run into with people is they're going to say, well, I hear so much contradictory information on the internet, how can anybody know what's the best thing to eat? I'll just keep eating junk food. And what I'm saying is, when you look at epidemiology, it's obvious. The low-fat plant food eaters, they're skinny and energetic. The high-fat processed food eaters with oil in their food, they're fat and sick. So the Pima are famous for being some of the fattest, sickest people around. And these are all the typical scars they get. Open heart surgery with a cabbage, coronary artery bypass, grab midline sternum, thyroidectomies, pacemaker in the upper chest, portacatheter on the other side for cancer, gallbladder surgery, right upper quadrant, appendectomy, right lower quadrant, sigmoidectomy for diverticulitis, left lower quadrant, below the knee amputation. Well, usually diabetics start out getting their toes amputated, then they get a midfoot amputation, then they get below the knee amputation, then an above the knee amputation. They're a disaster. Okay, so anyways, epidemiology makes it obvious. You just go through it one after another. The low-fat, low-sodium, plant-based eaters with no oil, they're skinny and healthy, their populations. And Dr. McDougall had said all of the healthy populations are starch-based populations. Mexicans were the people of the corn. In Asian countries like China, Korea, and Japan, they ate tons of rice. They're skinny and healthy. Okinawa, sort of the Hawaii of Japan, used to eat lots of sweet potatoes. So the point I'm showing you all this epidemiology stuff is it makes it obvious. And it's the same with all the epidemiology. It's always the same. The low-fat plant eaters are all healthy. And the sad thing is you go on the internet and you see all of these people lying, including famous doctors, lying to the public saying it's okay to eat high-fat diets or meat or oil, all this nonsense. It's kind of sad, but, really, there's not many people that care about the public. And it's also the case there's no money in helping the public. All right, so here's an atherosclerotic plaque. And the important thing to realize is that it's partially reversible. You can reverse the acute clot component. By the way, atherosclerosis is a blood clot. You can reverse the acute clot component of it. You can reverse the lipid core. That can be reabsorbed. The fat cells stored in these macrophages and whatnot. You can reverse the necrotic core. It's sort of the dead material. Also gets stored in the macrophage, for example. The highly cellular part of the fibrous tissue might be partially reversible. Once it's acellular, that's not reversible. Calcification in general is not reversible. I know some people are saying, oh, well, over the course of a long time, you can maybe partially resorb it. Fine, but, that's not going to really change your acute prognosis. What matters is you can shrink this plaque down so you get a big increase in flow because it's over R to the fourth. Plus, you start to make nitric oxide, again, the vasodilator, once the endothelial cell is healthier and you stop exposing it to sodium and to lots of saturated fat. So people can have a dramatic improvement in just a week, and that'll be ongoing for months. And that's been the experience in the work of Esselstyn, the work of Pritikin, etc. And that matters because you want to get more oxygen in your tissues. That helps prevent cancer, and it helps treat cancer, keep your tissue well oxygenized, keep it alkalinized. Okay, endothelium makes a vasodilator, nitric oxide. Okay, and so here's a little joke, this drawing here. Just like Jesus Christu, rose Lazarus from the dead. And this guy's Johnson is making a comeback. A lot of people have that experience, or Johnson makes a comeback. I mean, once the artery is occluded, it's not going to come back to be dental artery, but if it's just a stenosis, a narrowing, it might get significant improvement in erectile function. Lots of guys have had that. Okay, here is the sort of stages of diabetes. I just made these up based on, reading a lot about diabetes, and the whole point of it is, it's really a sort of a variation upon the theme of Gerald Shulman. He's the guy who won the 2018 award as the best diabetes researcher in the world, and he calls his theory the ectopic fat theory. And the point of it is that fat accumulation in skeletal muscle is the first detectable event in diabetes, insulin resistant type 2 diabetes. And that makes it harder for glucose to get into the cell, so you get high blood glucose after eating. It's called postprandial. Prandial means to eat, so postprandial hyperglycemia. Then you start to get fat accumulating in the liver, and that causes fasting hyperglycemia because the liver can no longer accurately sense blood glucose, so it keeps on releasing more glucose into the blood through gluconeogenesis, for example, and the breakdown of glycogen, so you get fasting hyperglycemia. So you go from postprandial, only after eating, to also fasting hyperglycemia. And then with time, you start getting fat accumulating in the pancreas, and that's thought to be toxic to the beta cells of the pancreas. And they progressively are damaged and die, and you lose the ability to make insulin. Then the patient's kind of screwed. They become insulin dependent. But the good news is if you catch this early, it's often reversible. Most of the time it's reversible. Dr. McDougall say by definition it's reversible. Roy Taylor published that all his patients with less than 4 years of type 2 diabetes, when they would lose 30 pounds or more weight, they would all be cured, virtually all of them. Okay, that's important to realize because there's lots of people that think that it's a sugar disease and eating carbohydrates is the problem. No, the problem is eating fat. There's other things that contribute to insulin resistance. I give an entire lectures on the subject. I made a newsletter on that subject, so we're not going to get into all of them today. But basically, eating a low-fat, low-sodium, whole food, plant-based diet and no oils is a good way to go. If you already have diabetes, work with your doctor because you'll need to get your dosage of your medications changed because you won't need so much medication most likely. Okay. The lecture by Gerald Shulman is on the internet. Just type in Gerald Shulman, MD, PhD, 2018 Banting lecture. You can see that lecture. It's an awesome lecture on diabetes. Okay. In a sense, what the cell senses is overnutrition. And then it's no longer wants any more energy nutrients coming in, so it shuts down the glucose type 4 transporter so they don't get sent up to the plasma membrane. Then glucose can't get into the skeletal muscles. Normally about 80% of your glucose postprandial should go right to your skeletal muscle and be stored as glycogen. Skeletal muscle is the biggest organ in your body, so to speak. Glucose stored in the glycogen in the skeletal muscle is only used locally by that muscle, whereas the glucose stored as glycogen in the liver, that is used, to maintain blood glucose during the fasting phase. And it's pretty good. It usually lasts pretty well for 24 hours. And more after 24 hours, gluconeogenesis starts kicking in over the course, especially of that 24 to 48 hour phase. And that's why I eat the OMAD diet, because I know it works, and I'm totally fine waiting 24 hours between meals. Okay, just a little bit more about blood physiology here. Dietary fat makes the blood opaque. So here is a blood draw in a test tube, and normal blood, you'll have the hemoglobin, red blood cells sedimenting down to the bottom if you centrifuge it. In the center, you'll have the white blood cells here in the platelets. That's called the Buffy coat. And up here, you'll have the plasma, which is, serous, kind of translucent. It just contains some proteins. It contains proteins like albumin, contains the immune globulin proteins, the blood clotting protein like fibrinogen. If you eat a high-fat meal, the plasma is full of fat, so it becomes much, much more opaque. It's a dramatic difference, and it's also in the actual flowing blood. It'll cause the red blood cells to stick together. That's called blood sludge or rouleau formation, and it's bad because it decreases oxygen delivery to the tissue. Okay, rouleau formation means a stack of coins in French. There was a good scene in the movie Game Changers where they showed that how thick the blood becomes in appearance, and you can't see through the plasma anymore after a high-fat meal. This was a research done by Peter Kuo. He was a cardiologist in Pennsylvania in the 1950s, and he fed his cardiac angina patients a high-fat meal with saturated fat, and he noticed that they would start getting episodes of angina, chest pain related to cardiac ischemia, lack of blood flow from the heart arteries being stenotic. right around 3 hours, and it would peak at around 5 or 6 hours, and then it would last, a couple more hours more than that, or their symptoms would tend to most readily be rare or to decrease. So anyways, at peak lipemia is when they had peak amounts of symptoms, consistent with the idea that it's the rouleau formation and blood sludge causing tissue hypoxia. Notice how sort of bold and crazy this experiment was. He was doing this back in the 1950s. There was no IRB, Institutional Review Board, so he was allowed to put these coronary artery high-risk patients on this high-fat meal. They had no angioplasty or stent in those days. All right, nowadays they wouldn't allow this experiment. Then after Ansel Keys, it's had all this stuff about how bad sat fat is for coronary artery disease. There was sort of an experimental basis. People thought, oh, well, gee, we should eat PUFAs, polyunsaturated fatty acids, like omega-6 cooking oil. So that became popular out of ignorance in the 1960s initially for a while. But then it got tested by some scientists, Meyer Friedman and Ray Roserman. They were, ophthalmology docs, and they got a 80-fold magnifying glass microscope, and they would put it over the patient's eyes. And what they found was the PUFAs, omega-6 cooking oils, they produced even more prolonged blood sludging. It was a big deal because the workers started working at 8 o'clock in the morning, and in the evening when they wanted to go home, the blood was still thick, and so they didn't feel it was safe to go home, so they were kind of pissed off about that. It had a very prolonged thickening of the blood effect. Omega-6 fats are much worse for health than people realize, and omega-3s are have much more problems than are widely realized. I recommend you avoid all of them. I think all that stuff promoting omega-3s, omega-6s, PUFAs, MUFAs, I think it's all a bunch of nonsense, by the way. I have other videos on it, but just so you know. Dr. Quoll also noticed that the thick blood caused a 15 to 20% drop in oxygen delivery to the tissues. Roy Swankin noted, studying hamster brains, that you can sometimes, after a high saturated fat meal, cause a 30% drop in oxygen delivery. And that's the point I was making earlier. If it takes 35% or more oxygen delivery drop to induce cancer, according to the research Otto Warburg, can you imagine the net combined effect you're having when you're eating a high-fat meal with sodium? Sodium is a vasoconstrictor, inhibits endothelial nitric oxide. You got the fat sticking the red blood cells together, dropping oxygen. And then very often in a junk food meal, like let's say a person has a pizza, there could be mitochondrial toxins in there. For example, if there's corn sweetener or something in there, the atrazine, that's a mitochondrial inhibitor. If there's soy in there, that's typically sprayed with GP, glycine phosphate, and that is also toxic to mitochondria. So you're doing more and more things that drop mitochondrial function, which is kind of almost equivalent to having increased fat and dropping the oxygen delivery. So the more you're decreasing mitochondrial function, the more likely that cell is at risk to transform into cancer or to favor cancer growth or to simply become dysfunctional or to even go into apoptosis. So it's not smart. Okay, obstructive sleep apnea patients are notoriously stupid. Anybody that's been around a lot of patients knows probably the stupidest patients are like kidney failure patients on dialysis. They're notoriously mentally slow. And obstructive sleep apnea patients, they're falling asleep in the middle of a conversation. So you don't want to end up like that. So the way to avoid that is avoid hypertension, avoid diabetes, avoid becoming obese. Theoretically, they say that obstructive sleep apnea, OSA, patients have excess fat in their airway, but it's really hard to see that. I've looked at many thousands of necks, and I almost never see, significant amount of fat there that's going to make me think this person's a sleep apneic. Other researchers think that it's in major part caused by neuropathy. That would make more sense to me. I don't know for sure which, but that would make more sense to me. Either way, they have poor oxygenation and they'll have low oxygen sats at night. I've seen, dropping their sats into the 60s. They don't usually drop them down that low, but you see how this all synergistically adds up. They could be dropping their oxygen saturations down into the 60s, getting hypoxia for this reason. They could have hypoxia from a high-fat meal, hypoxia from high-sodium meal. You combine that with mitochondrial inhibitors, you're talking about a pretty big drop in mitochondrial function. Okay, and you could be losing brain cells, apoptosis. Okay, we'll call it there for tonight. Hope that was helpful.